Okay, I'm with Dr Funmi Oyesanya for the next Q&A for the VICTA Virtual Science Fair. Thank you for joining us. You've come to us through the Royal College of Pathology. Perhaps you could tell us a little more about yourself and what you do.
Cool. Yeah. So I am a haematologist. So I'm a haematology doctor, and I am currently working at Barts Hospital looking after patients with haematological cancers. So I've been doing that for the last 5 years. And my job at the moment mainly entails looking after the cancers, giving chemotherapy, seeing patients in clinics. But in a broader sense, as a haematologist, I also do a lot of microscopy work, so looking down the microscope at cells and trying to diagnose haematology problems. I do a lot of work with blood transfusions, a lot of work with like cancerous conditions like sickle cell, thalassemia, haemophilia, and I also do some procedures. So I do bone marrow biopsies, and I give chemo into people's spines and take fluid out of their spines to try and diagnose what's going on with them. So yeah, it's quite a varied sort of role that I have. It's good fun.
It sounds quite an intense role as well, quite detailed. Why that particular area in particular?
So before I was a haematologist, I decided I wanted to do medicine rather than surgery, and it took me quite a long time to decide to do haematology. But what I realised is it kind of, I actually think back to why I decided to become a doctor. It kind of marries my love of science to kind of my love of just talking to people and looking after people and trying to get them better. And haematology is one of the only specialties in medicine whereby you treat your patients, especially your cancer patients, with the chemotherapy yourself, but you also do the procedures to diagnose it, i.e. the bone marrow biopsy, but you also read that biopsy. So you use your basic science, like your basic science skills in every little part of haematology, and that's what I really enjoyed about it, and still really like about it. And even today, like my your like knowledge of genetics, your understanding of microbiology, my understanding of transfusion medicine. Like I'm still in the hospital now, and I've used all of those skills today, as well as my actual technical knowledge of being a doctor. So yeah, it's intense, but yeah, I really enjoy it. And
like you said, quite varied as you've just described.
Yeah.
Probably quite difficult to describe what an average day looks like, but perhaps maybe an average week. What does your workload look like over the course of a week period, sort of thing?
Yeah, so an average day at the moment is, and it's been interesting at the moment with everything that's going on with COVID. That's really impacted actually my average day, because usually on my average day I'll do a ward round of all my patients. I would then maybe go up to the lab, I'd look at some blood films, and also maybe report some bone marrow biopsies. And then in the afternoon, I'd usually spend my time going back onto the ward to speak to patients and their families and to give them an update on their conditions and all the treatments that they're having. I'd possibly also then go to clinic to see my outpatients and sort of get updates on how they're doing. That's changed a little bit at the moment because can't really have patients' relatives in the hospital, which has been really quite difficult, obviously, for the patients, but also for us as doctors. Not really getting that. I've really noticed that patients aren't really getting that support that they need from their families. So now my average day spend a lot of time putting on masks and gowns and all my PPE, washing my hands all the time, seeing all the patients, being a bit paranoid about not wanting to give COVID to my patients. And I spend a lot of my afternoon and evenings actually calling patients' families to give them an update as to what's going on, because I just think it's really important for them to know what's going on. So yeah, that's changed a little bit. When I'm doing a more lab-based job, my day would look more like I would be liaising with other teams about abnormal blood films that I've looked at down the microscope to let them know what's going on. I would be liaising with other hospitals about bone marrow biopsies. I'd be speaking to the molecular haematology teams and our immunophenotyping teams and the other labs about all the different marrows and how to bring all of the results together.
Wow, so there's quite a lot that you have to put into your day, into your
Yeah.
week.
It's quite busy.
So as part of the Q&As, we spoke to a medical student who was halfway through a 6-year medical degree. I'm assuming you had to do something quite similar. What was that like? And for any young person seeking to do something similar, what might be your advice before they try and get themselves through a 6-year medical degree?
So the first thing I would say is I really enjoyed it. I actually quite liked being at university for 6 years. So I thought it was quite fun. But it is tough, and it is a lot of work. But the way that I got through it is that it was leading to what I ultimately really wanted to do. And the reason it has to take 6 years is that not only are you essentially doing a part science degree, you also then have to learn the skills needed to be a doctor. So it just takes a lot of, not a lot, a bit of focus, a lot of actually wanting to do the job, a lot of compassion, because I think when, as a medical student, you go onto the wards for the first time and you see what patients are going through, and for me, I started to imagine myself, when I'm a doctor, I'll be able to help these people, and that's kind of what got me through medical school. But it is a long slog, but it's really worthwhile. I can't think of anything more worthwhile personally, but I'm very biased because I'm a doctor, but I think it's really worthwhile.
Brilliant. Okay, fantastic. Well, thank you for joining us for the science fair. Thank you.
No, completely.